Good to have Brenda MacLean here from the Communicable Disease Control and Outbreak Management. How are you, Brenda? Good to see you. And this is Ricardo Lucchini. Did I get that right, Ricardo?
Lucchini.
Yeah. Lucchini. Ottawa public health nurse. We're talking about the flu shot today, ladies and gentlemen, because it is flu shot season. Already, I've seen people around town. There's a flu bug going around already.
Right.
Yeah. So this is the time of year when you take advantage of the clinics that are being offered, right?
That's right. They start tomorrow, October 27th, at Holy Trinity High School in Canada.
Right. And there are lots of clinics available coming up in the near future?
There's 33 clinics available from Ottawa Public Health, so yeah, spread throughout the city.
Right, right. Easy to get one.
Easy to get one.
Yeah, I know a lot of workplaces here, for example. Next, I think in a week and a half, we have a flu shot clinic here. So a lot of businesses set up that sort of thing.
That's right.
Give me some idea of the advantages of getting the flu shot. Why should I do it?
The flu shot is actually for everybody, even healthy adults like yourself. Certainly there are some people who are more susceptible to getting the flu and possible complications, like the elderly, the very young, people with medical conditions. But one of the things that people don't realize is that you can carry the influenza virus, pass it on to other people who may be more apt to get it and more apt to get complications.
So elderly people, people with respiratory illnesses,
That's
young
right.
children,
That's right.
that group are more susceptible to receiving it from somebody else.
That's right.
Wow. What kind of flus are we looking at this year? Do we know yet, or any strains that are available?
The most predominant strains seem to be H1N1 and H3N2, which is good in the fact that we have that in the vaccine this year.
Right.
So we haven't had flu. We haven't had much confirmed influenza yet in our area, but based on what's been going on in the southern hemisphere, that's a good match.
I guess all the other things that go with protecting yourself during the winter months, I mean, a lot of it's common sense, let's face it. Dress warmly and appropriately, right?
The most important things, if we can get one message across, is wash your hands. And even though people say they do wash their hands, we know that they don't wash their hands as much as they say they do. So that's a really important.
So at every opportunity, basically, wash your hands. Like a lot of people have these disinfectant pumps at their desk, or we have one here as you enter the building and so on. Good idea to use those?
Great alternative.
Yeah.
So good to have them all over the place and easily accessible.
Yeah. Ricardo, there's not much to it when it comes to getting the flu shot, although the first thing you had me do was fill out a consent form, right?
That's right.
And then you asked me a couple of important questions.
Ask you questions, make sure you don't have any allergies to any of the components,
right,
and that you're a good candidate for the vaccine.
Yeah. Now, I've had the flu shot before. Matter of fact, I get it every year. What if I'm new to this? Is there, something you should be telling me as a nurse?
So if you are new, we do go through a screening process with anyone who's going to receive the vaccine. We make sure that they don't have any allergies, any severe allergies to any of the components.
Yeah.
Make sure they haven't had any previous serious reactions to any other type of vaccine.
Right. Right, I never have any reactions to this stuff, so I'm ready to go. I'm going to go right arm.
You're going to go right arm?
Because,
okay.
There's the Boston Red Sox tattoo. That's nice. Did you like that? That's pretty. Eh? That is nice. On the other side, by the way, is number 6 for myself and Johnny Pesky. Anyway, so you got to disinfect the area, do the regular things that happen when
wash my hands before touching you.
Gets a shot. Pretty quick process. Doesn't take any time at all. What should people do if they have a reaction?
So if someone does have a reaction, they let us know.
Yeah.
All the nurses are prepared to deal with any reaction.
Right. Could a reaction happen later?
It could happen later. However, most reactions happen within the first 15 minutes of getting a vaccine.
Oh,
so
is that right?
That's why we ask people to stay at a clinic for 15 minutes.
Yeah, we also have Jeff Hopper on standby just in case things go badly.
Okay, take a deep breath, please.
It's virtually painless, ladies and gentlemen. Seriously, there's no big deal to it at all. So how do I find out more, Brenda, about where to find the flu clinics, flu shot clinics, and all that sort of thing?
People can go onto our website, ottawa.ca/health, or they can call us at 613-580-6744.
Simple as that. Eh?
As simple as that.
Thank you both for coming in today.
You're
See,
welcome.
once again, this is a bonus for me every year. I do not have to go to any clinic. I just go to work, and it happens for me. Thanks a lot, you guys.
Thank you.
I feel safer already. In fact, I feel really good right now.
Do you want to go on a date?
No.